overview of cultural safety tools. First up is Dr. Rachelle and Dr. Mike Evans from UBC, and they'll be doing an awesome presentation on the tools that they've been working on here for a number of years. And it's been really interesting and enjoyable. I emphasize enjoyable working with Mike and Rachelle the last couple of years. And so I'll hand it forward to Mike or Rachelle. So here we go.
Can't be good to be short, so we're going to be short. And we're really going to talk a little bit about some research that we and a number of other people, including a number of people in this room, have been doing for the last number of years. And fundamentally what we're talking to you about right now is the problem, the issue, the question, the challenge, if you like. And our exploration of that challenge started a while back with a project, Barriers for Urban Aboriginal People Accessing Social and Health Services. And very briefly, the results of that research led to a subsequent project, specifically with Vernon Jubilee Hospital and IH, looking at cultural safety and some interventions. Specifically, what drove this was a tremendous need. Now, this graph actually graphs the results of the Barriers Project, which tracked, through a series of interviews, how Aboriginal people were experiencing health and social services. This particular one was a theme that emerged very strongly around problems and issues in diagnosis and treatment, so specifically healthcare. And this graph compares positive and negative and neutral comments from Aboriginal interlocutors, Aboriginal people, about their experiences, and the green bars are non-Aboriginal organizations delivering services, and the blue bars are Aboriginal services delivering services. Fundamentally, there's a tremendous and marked pattern here where Aboriginal people feel very poorly served by non-Aboriginal organizations, period. This is across the entire study. And diagnosis and treatment in particular was a problem. So these really fundamentally refer to the healthcare system, which is what subsequently sharpened the focus of the research. This last slide is actually the count of comments. And what you see here again is because very few Aboriginal services provide, Aboriginal organizations provide healthcare services, most of the experience of Aboriginal people with healthcare services are negative. Markedly so. And indeed, the more Aboriginal you appear and the more female you are, the more the markedness of that negative experience is expressed. And I know this table is a little bit difficult to read. I didn't really intend you to read it. I just intended you to know that what this table shows is the more Aboriginal you appear and the more female you are, the more and profoundly more negative experiences with healthcare and social service delivery systems you have. Period. This is, in other words, this is a problem, and this is the empirical evidence that establishes this as a problem. A more nuanced and powerful way of thinking about what this problem feels like comes directly from what people had to say. Right? We don't have time to go through the methodology here, but I want to give you an opportunity to look at a couple of the things that people had to say about their experiences. So those are the numbers, first couple of slides. Here is the nuance, here is the texture, here is the emotional impact of people's experiences coming out of their interactions with health and social service delivery systems in the economic value. Profoundly negative. I'm not going to read some of this stuff out because sometimes I find it very difficult to do so. I'm going to let you read it. But profoundly negative. This is a problem. And these problems are the root of why it is we started to pursue an active agenda of exploring opportunities for cultural safety.
So the subsequent research project was the Cultural Safety Research Project, which we did engaged in collaboration with the Okanagan Nation Alliance Wellness Committee, and so we really want to thank the Wellness Committee for their partnership, as well as many community members and urban Aboriginal organizations as well. And as you can imagine, given the summary that Mike just shared with you about the Barriers Project, when we talk to community members around their experiences of healthcare in the second project, again, overwhelmingly, people spoke about negative interactions in terms of their healthcare experiences. One of the key things was that people talked about, as Mike said, when they were identified as being First Nations and Aboriginal, they felt that that's when discrimination and racism occurred. So, as this quote says, yeah, I don't know, they look at you and they see your First Nations and their attitude changes. You can hear them. You're in the emergency room and they're talking really nice to someone who's not Native, and then they come into me and their attitude changes, eh? So they're not all like that, but I run into that quite a bit. But what was interesting about, so we talked about the problem, this whole idea about being visible. In the Cultural Safety Research Project, what we also found is that when First Nations and Aboriginal patients and community members were identified as Aboriginal and treated with respect and dignity, they actually talked about positive experience in terms of their healthcare interactions. So one community member said, you know, but if I stayed later than regulation time, nobody ever said anything, and I didn't stay longer than maybe half an hour or so. I was up at a hospital when a friend was dying, and there was mega Native people there, and nobody complained. We were in the hallway and in the room, and nobody complained. In fact, the nurse's station was just right there, and they told us where we could go to get a cup of coffee if we wanted to get a coffee or something to drink, whatever. They were really good. I was really impressed. So what we took away from this research is that when First Nations and Aboriginal people, when their indigeneity is respected, that's one of the first steps to cultural safety. And just to end, we want to end with this quote here. I think if you did this interview with non-Indian people, you'd get a lot of the same answers in the fact that they haven't been treated well, that they were afraid in the hospital, and the fact that they were in a cold environment and all kinds of things. There's a whole different world when it comes to us and the oppression that our people have felt. Smaller things, words, looks, movements can insult us and make us feel powerless. And they don't even know they're doing that because they're not even aware of all the difference of our world. And that's why I really like the fact that this cultural safety thing is spreading around like it is. Thank you.